Hi, I'm Dr. Asif Shaik, CMD of ALUX Dental. I'm a maxillofacial surgeon with special interests in dental implantology and cosmetology. This is a part of a video podcast series. The intent of this series is to educate and spread awareness about dental procedures, dental products, and oral health and hygiene. And today I am here with my prosthodontist, Dr. Ananth. We shall be discussing about a case. So this is a patient who's a doctor. She's a medical doctor, and way back when she was doing her bachelor's in Goa, she went to a dentist and got an implant done. Now, if you take a look at that implant, the implant could have been, in terms of configuration, could have been bigger, could have been wider. That's okay. That's a part of a different story altogether. Now, if I look at the implant, the position of the implant is slightly distally tilted, right? And there was a good amount of bone which was on the implant, so we had to do an exposure surgery. And post that, I handed over this case to my prosthodontist, that's Dr. Ananth. He would comment on what he faced with this particular case.
Hi everyone, I'm Dr. Ananth, clinical prosthodontist at ALUX Dental. When we look at the case initially, we clearly can notice that the implant is distally angulated and the tooth distal to that implant is mesially angulated. So this situation is a concoction of two converging prostheses. So to handle this prosthetically, we had to think of few options where we thought of giving a custom abutment, which would be ideal in this situation because you notice that the prosthesis on the implant is going to be bulkier on the mesial side. So to accommodate this bulkiness, custom abutment would have been the best option in terms of force distribution. So to make a custom abutment, the first choice would be to go for an implant level impression. But again, keeping the situation in mind, we know that there are two converging tooth and implant in this situation. So what we did, we first tried with the impression coping. We put a closed ray impression coping over there on the implant, and you can see in the x-ray that it's not fitting well. That's number one. And second, it is going and touching the distal tooth. Now with this, we still went ahead and made an impression, and you can see in the photo of the impression that there is a clear void which indicates that the impression coping is touching the adjacent tooth. We still went ahead and poured the cast because we wanted to get a cast in our hand and understand how we can tackle this situation in our lab rather than on the chair. So we went ahead, we got the cast of the patient. As I told first, our first choice would be to go for a custom abutment in this situation, which means I want to take an implant level impression. So there are two ways in which I can take an implant level impression. Either I use a closed tray or an open tray coping, or I use a scan body in this situation. But if you look at the implant, we identified it to be as noble regular platform. And if you look at the regular platform implants, we get a scan body of height 5.5 mm and the regular coping that we get is almost 9 mm in height. In this situation, in both the situations, it is warranted that the scan body or the impression coping is going to go and touch the adjacent tooth, which is primarily going to negate all the attempts that I'm going to make to capture an implant level impression. Now that being said, that pushes me to the next option available, which is to go ahead and make an abutment level impression. Now in abutment level impression, especially with Noble Biocare, we have the aesthetic abutments, we have the angulated screw channels, but considering the situation here, we went ahead and we chose a 15-degree aesthetic abutment in this situation. So with that abutment, we were able to correct the implant angulation that was distally inclined, and we went ahead and we made an abutment level impression. Now this abutment level impression was sent to the lab, and you can see that the aesthetic abutment that we have used, the 15-degree angulation that we have used, is providing us a good amount of space between the adjacent tooth and my implant prosthesis. Of course, we did bear in our mind that the distal surface of the prosthesis on the implant could have some kind of a metal exposure, or in case of zirconia, the thickness could be less. Keeping this in mind, we were sure that some kind of an occlusal adjustment would be required, and that will be taken care of when the patient comes back to us. Now that being said, one more option at the abutment level would be to use a snappy abutment, which is the stock abutment from Noble Biocare. But if we look at the snappy abutment, there were two problems that we faced with it. One, the ring or the abutment margin that was going to go and engage was facing a lot of interference from the bone. That is number one. And second, the height of the snappy abutment was still going and touching the adjacent tooth.
Right.
Now, because of these two reasons, we had to choose an aesthetic abutment or a 15-degree angulated. We went ahead, we made the abutment level impressions. We are aware of the pros and cons of this abutment level impression we have made, and these will be definitely accommodated for in terms of the occlusion that will be given for this prosthesis. So that brings us to the way we have handled this situation, and over to Dr. Asif.
So this is a classic case where a patient goes for an implant surgery. The implant surgery happens to be pretty okay. The patient doesn't have any complaint. Implant is placed, but is the surgery done in the right way? Has the implant been placed optimally? Was the choice of implant the right decision for that particular patient? All this would come to account when you start rehabilitating that implant, when you start giving a crown on that particular implant. So in this case, because the implant is distally tilted, there were a lot of challenges, and these challenges had to be dealt diligently and tactfully. And thankfully, because of my prosthodontist, Dr. Ananth, and me working as a team, we were able to rehabilitate this case. There were some challenges, but I think with the angulated abutment, we were able to rehabilitate this case. Yeah.